Good morning. Well, it's not every day that one gets the opportunity to interview their hero. And today I'm honored to have the opportunity to do just that, whilst covering two of my most favorite topics, global health and the work of the Jane Goodall Institute. As a doctor of public health, serving as a member of the board of directors of the Jane Goodall Institute of Canada, helping to grow the transformational work and legacy of one of our planet's greatest defenders has been one of the great honors of my life. And it actually all started right here at the Canadian Conference for Global Health. It was after giving a keynote at this very conference back in 2013 when I had the opportunity to share my research on the Cola Life Project and our work on transforming access to ORS and zinc for childhood diarrhea, that I was approached by JGI Canada to explore the idea of serving on their board, which was more and more moving beyond chimpanzee conservation and focusing on the intersections between animals, people, and the environment. 60 years ago, Jane Goodall first set foot on the shores of what is today Tanzania's Gombe National Park to begin her pioneering research of chimpanzee behavior. For 6 decades, her research has transformed scientific perceptions about the relationship between humans and other animals. In fact, it was her work that made the world reconsider the definition of what it was to be human, having demonstrated that chimpanzees too use tools and that man, the tool maker, was no longer a unique identifier. And perhaps it's no wonder, given that we belong to the same family, right? Homo sapiens have long preferred to view ourselves as something separate from other animals in the environment, orphans without family, lacking cousins and even parents. But this just isn't the case. We are, in fact, members of a common family called the great apes. Our closest living relatives are the chimpanzees. And just 6 million years ago, a single female ape had 2 daughters. One became the ancestor of all chimpanzees, and the other was our own grandmother. Today, Jane's message has evolved and grown into a quest to inspire, empower, and motivate others to make the world a better place. It gives me great pleasure to introduce the founder of the Jane Goodall Institute and United Nations Messenger of Peace, my hero, Dr. Jane Goodall.
Well, Rohit, thank you very much for inviting me for this conversation, and I always look forward to talking with you. So good.
Likewise. We are so excited to have you. Well, Jane, today is all about the health of human civilization and the state of the natural systems upon which we all depend. The fact is, we need to have a healthy planet to have healthy humans. And the COVID-19 pandemic has really brought this fragile relationship into focus. Can you perhaps start by talking a little bit about some of these relationships that have been brought to bear within the context of this pandemic and other emerging diseases as well, and what they've taught us about what we need to consider and how we need to move forward?
People studying these zoonotic diseases, those that jump from a pathogen in an animal to a human, they've been predicting for a long time that a pandemic of this sort would inevitably happen if we went on disrespecting nature and disrespecting animals. So as we destroy habitats, animals get pushed into closer contact with people. Sometimes they move out into cities or villages searching for food because their own food supply is diminished. And people are hunting them, killing them, eating them, moving deeper and deeper into what remains of their habitat. And people are trafficking them. And that means that animals are being sent from a region or sometimes other parts of the world to the wildlife markets in Asia, to the bushmeat markets in Africa, to the markets that abound in other parts of the world selling exotic animals as pets. And these markets are typically A, extremely cruel, B, they're usually rather unhygienic, and it's a perfect environment for one of these pathogens, in COVID-19 is a virus, to jump from one animal to one person. And sometimes a jump of that sort leads to a new disease, and sometimes that new disease is very contagious. And unfortunately, COVID-19 has been extraordinarily contagious and has swept around the world. So what do we need to do? We have to learn that we must respect the environment. We can't continue to destroy it. And we must respect animals and not treat them in this terrible way. Otherwise, we'll have more and more epidemics and pandemics. And the last thing to say here, it's not just wild animals. It's also the intensive animal agriculture. These billions of animals, also in horribly cruel and almost always unsanitary situations. And again, many diseases, new diseases, have jumped from one of these animals to a human.
There was a question from one of this year's conference delegates who noted that, while it's easy to convince scientists of the important links between conservation of nature and zoonotic disease emergence, it's perhaps more difficult to convince decision makers to invest more resources in this space. What is your advice for people who wish to better communicate One Health concepts to, one, I guess, better convince governments to invest, and two, to convince the public really to practice behaviors and live in ways that are aligned with One Health principles?
When it comes to governments and also leaders of corporations, I think this goes together. One way to convince them, I know that certain economists have actually worked out the cost of dealing with a pandemic like this versus the cost of protecting the environment. I always believe you have to try and reach the heart of whoever you're talking to. To make a sweeping statement, how do we convince them? I don't know. But if I'm speaking to an individual government leader or corporate leader, then try and make some kind of connection and tell a story that will reach in here. And when it comes to the general public, well, they're wising up. And I get so many messages from people saying, well, this has really given me time to think. I realize that we have to change our ways. I realize that when we emerge from this pandemic, as we will, we need to rethink our relationship with the natural world. We need to push for a new green economy. We've got to stop always putting unlimited economic development globally ahead of protecting the environment, for the health of the planet, our health now, and future generations.
So, Jane, as you know, with the support of Global Affairs Canada, JGI Canada has run a number of community-centered conservation projects across the chimpanzee range, which spans from West Africa all across the Congo Basin. So we have projects in the DRC, Uganda, Senegal, and with their support, we've also recently launched the International Aboriginal Youth Internship Initiative, offering Indigenous youth in Canada the opportunity to gain professional experience through international development work. In this vein, another member from our audience today wanted to know, what advice would you have to ensure that the perspectives of Indigenous people are taken into account in the implementation of One Health approaches in Canada's North? And in your experience, what are the facilitators and barriers to integrating Indigenous perspectives?
I can really only speak from experience that I've had in America with Native Americans. And it's not easy, but I do know that in Canada, our Roots and Shoots youth program has made inroads. And I think what's really important is to find key Indigenous people, because they need to be the leaders of their communities. They need the support, and we need to find them, concentrate on them, and they'll be the ones to pass the message on. So it really needs to be Indigenous people of the area. And that works in the US.
You talked a little bit about Roots and Shoots, you mentioned Roots and Shoots, and the youth involved in our Aboriginal Youth Internship Initiative are amazing young change makers. And Jane, you've often commented on how youth are uh, a reason for hope. And in our recent WHO report, which we called Engaging Young People for Health and Sustainable Development, my colleagues and I highlighted the work of the Jane Goodall Institute, because all this amazing stuff that's happening through Roots and Shoots, and the fact that the world today has the largest generation of young people in history, with 1.8 billion people between the ages of 10 and 24 years. So another question from one of this year's delegates was, can you comment on how to better integrate youth voices into frameworks and government structures, such as those that are implementing One Health, so that these can influence policies, procedures, and programming?
Well, I think it's actually happening. And the reason it's happening is because young people are becoming more aware, more educated. And I found with Roots and Shoots, which is now, by the way, in 68 countries, and we have members, kindergarten, university, even older, everything in between. And these young people, they are learning at school and from the media about environmental issues that I never learned about, because actually those issues weren't pressing back when I was young. But today, it's all around them. They can't escape the news that we're battered with about climate change and species extinction, and of course now the pandemic. And one problem is that so many feel depressed. That's why I started Roots and Shoots, for that very reason. They said, well, you've compromised our future and there's nothing we can do about it. We have compromised the future of young people. The saying we haven't inherited from our ancestors, but borrowed it from our children, isn't true, because we've stolen, not borrowed. But I didn't believe them when they said there was nothing that could be done. And that's why Roots and Shoots began, with its programs encouraging young people to think of their own projects. They think of them to help people, to help animals, to help environment, because it's all intertwined. And so, as up until the pandemic, I was traveling 300 days a year around the world. I was meeting young people who increasingly had been empowered, not only by JGI, but there are other youth organizations as well. And once they understand the problems and they're empowered to take action, and they use this amazing intellect, which is the one thing that separates us most from chimpanzees. They use that intellect to have discussions with each other and with people in the community. This is what I care about. What can I do? What can we do? Oh, that's a good idea. Okay, then roll up the sleeves and get out and do it. It's all about taking action. And I think, to answer your question, how do we involve these young people with decision makers and so on? It's actually happening. And we have to remember that a lot of these young people, they have parents who may be in decision-making positions. They may be in politics. They may be CEO of a big corporation. And young people are definitely influencing their parents. And I know that because I'm told about it all the time. And some of those parents that have written to me have been in decision making. And also there's a big push, I think, everywhere to give young people a voice. So, as I say, it's happening. And I think it will continue to happen as long as the young people approach it in the right way. And here's the danger. I grew up in World War II. I learned to take nothing for granted. Everything was rationed. The young people today in affluent societies, where there is great need to influence decision makers, they tend to take everything for granted. It's not their fault. They've always had it. And taking something for granted, well, it's not a good idea to approach a, a powerful government agent or big business person with the attitude of, you've destroyed my future, you have to do something about it, because that high up person isn't going to want to listen.
Yeah.
So again, reaching into the heart, telling stories about something that you've witnessed or that you've read, so that these people, they must change from within. We can't force them to change. I mean, yes, we can use the money story, but that doesn't really change them. Not really. They don't care about the environment just because they realize it's cheaper to save it than destroy it.
Jane, I guess I'll start winding down today by first of all recognizing that this year marks the 60th anniversary of when you first stepped foot in Tanzania and began your research on the chimpanzees of Gombe. What can we learn about the health of human populations from the chimpanzees of Gombe? Are there any observations or lessons that we can draw upon, particularly, I guess, within the context of this changing global landscape?
As we've learned more about the biology of chimpanzees and some other animals, we realize that these diseases actually can go both ways. We can catch them from animals and they can catch them from us. But when animals are out in their natural environment undisturbed, we're very, very unlikely to be infected by a pathogen in that way. And more to the point, I think, what the Gombe chimpanzees have taught us is that animals are sentient beings. They're not just things to be used to be hunted for trophies or food or whatever else. They're beings with personalities, with emotions. They're intelligent, amazingly intelligent, some of them. And the way that we've been treating them is what's led, in part, to this pandemic. And it's the same disrespect of the environment that's led to climate change, because this is what we have to learn. And somehow the chimpanzees are all tied up in it because for them it's desperately important we save and restore forests. Saving and restoring forests absorbs CO2 and gives us water and clean air, helps mitigate climate change. So they've just taught me that everything is interrelated and you can't address one piece of the problem without thinking about the other.
As a global health practitioner, an emerging area of interest for me is global mental health. In particular, kind of exploring how to scale concepts of consciousness and mindfulness. The 2018 Lancet Commission on Global Mental Health and Sustainable Development identified mental health as a global public good, an essential component of universal health coverage, noting that the world has seen a rise in the burden of mental disorders over the past 2 decades, let alone during this pandemic. Jane, perhaps to kind of close things off today, what lessons have you learned about mental health, whether from your time living in the forest or otherwise?
I learned from my own perspective that being out in the forest or out in nature, particularly by myself, I feel a real deep connection with some spiritual power. I don't know what name to give that spiritual power, but it certainly serves to strengthen me. I never proselytize about it because other people have different ideas. And there have been a lot of studies now showing that young children actually need to be out in nature. They need the green spaces and the birds singing for good psychological development. There's other studies that show very, very clearly that if you take an area of high crime in a city and you green it, you put you put plants in any vacant space and you bring in trees, the benefits are huge. First of all, the trees provide shade, they bring nature in, there's bird song, the roots stabilize the soil, they sift through the air, make the air cleaner. But in addition, it's had a striking effect on mental health. And again, many economists have worked out the saving in health costs by people living in a green environment, which really points to the fact that it's terribly sad, but in the poorer areas of a city where the disadvantaged people live, you don't find the trees. The trees are all where wealthy people can afford space or afford to put trees lining the wide road. So it's very important for the sake of the health of the people that we start greening these disadvantaged areas in cities. And in one study, this was in Chicago, they took two similar areas, disadvantaged people, mostly the Black community, and one of those areas they greened and the other they didn't. Both were high crime areas. Crime dropped quite dramatically in the green areas. Of course, they quickly greened up areas as well, but it does save a lot in health and crime prevention and so on. No question about it.
This kind of idea of combining activism and science. My students have asked a lot about this topic, about how do we bring the scientific evidence to bear in our activism. What lessons and insights do you have on kind of combining these two tools?
Sometimes science tends to be rather cold and objective and sort of ivory tower stuff, and people don't want to read it. And even if they do, sometimes it's cloaked in scientific jargon. So the first thing is to have science expressed in a way for people to understand, a way that will interest people. And then secondly, to have people begin to understand, because of that, how important it is to weave these facts together into stories that will reach people's hearts and change their minds. So it's a lot to do with science, which I think is why it took so long for young women to want to go into science, because I was told you can't show empathy with your subject. And two recent books written about how trees communicate, one German forester, one Canadian forester, and they both started using the language of science. And then they realized, well, people weren't interested. So they started using things like trees communicating. People are now absolutely fascinated, looking at forests completely differently, thinking about trees as individual beings, which they are. And so it's this kind of thing. It's not changing the facts, but the way you present the facts. And once you do that, then it automatically gives food to the activists.
Great advice. Jane, on behalf of all of us involved with the Canadian Conference for Global Health and the global health community more broadly, thank you so much for sharing your time and insights with us. Are there any final thoughts you'd like to share with the audience today?
There's one message which I don't think that can be a more important message. And that is to remember that every single day, each one of us lives on this planet, we make some kind of impact. And we get to choose. Not everyone can choose, but probably most people listening to this, and you and me and JJ, we can choose what sort of impact we make. We can choose what to buy. Where does it come from? How was it made? Did it harm the environment? Was it cruel to animals? Is it cheap because of child slave labor or sweatshops? If I buy or move to a vegetarian diet, that means that all this meat industry will stop harming the environment. And so it's the little choices we make each day, because people feel helpless and hopeless, but every single one of us makes a difference every single day. And I think that's a very important message.
Thank you. Thank you, Jane, so much. On behalf of all of us, thank you.
Well, thank you too.